Hi everybody, my name is Melissa Johnson. I am with Optiques, and with me here also is Dr. Robert King. He will be coming up in just a few minutes to talk to you guys as well. I will try not to take up too much of your time, but I just want to go over a couple of things that I think might be useful to anybody that wears glasses. If you have family and friends that wear glasses, you can kind of educate them as well. So I would just want to start by giving you a little background on myself and Dr. King. Dr. Robert King is a general ophthalmologist. He's been in practice for 50 years. He went to college at BMI. He went to medical college at UVA. He was in the Army's Medical Corps, and he completed his residency at MCV, where he also was on the faculty for 10 years teaching. He's been in private practice now for 40 years. Let's see here. As far as Optiques, we're going on our 5th year being open. We're open on Parham Road, right across the street from J.R. Tucker, so we are local. So when we're not here on clinic days, we're not that far away from you guys. I've been in the eye industry one way or the other for about 20 years now. I worked as an optician, as an ophthalmic coder, front desk, revenue cycle manager, also as well as a trainer. So I've kind of hit all the aspects of the eye industry in one form or another. I wanted to open an optical shop because I've worked for larger retailers, private ophthalmology practices, and I really felt that there was something missing as far as patient service, actually listening to your patients, not trying to sell them on something that I don't get a quota each month that I have to sell you something unnecessary. I don't get any bonuses, even though I do accept tips. But so I thought it was really important to actually provide glasses and coatings and lenses that were going to fit the individual patient's needs and their lifestyle. So what's different coming to Optiques? We will be here on location. You'll see it on your monthly calendar. I'll go into that further on how you can schedule either here or at our local office. I would like to actually now take a minute or two to show you a commercial that was made specifically for our Cedarfield family. So if you don't mind, we'll just take a minute and show everyone that commercial.
Optiques at Cedarfield, where all of your eye care needs can be met without ever leaving your home. Book your appointment easily by phone or online through Optique's website. Come over to choose from one of our many stylish frames, or you can even use your own. Want to get the best vision that fits your individual needs? Our Verilux Progressives offer the widest and clearest range of vision for reading, intermediate, and distance. Single vision reading glasses are ideal for long-time reading, sewing, or any hobby that requires close-up work and is specific to your prescription, unlike over-the-counter readers. Anti-reflective coatings like Crizol offer protection from glare and harmful blue light that cause macular degeneration. Had cataract surgery? You may have noticed starbursts, light sensitivity, and glare. Choose a polarized sunglass and get 50% off the lenses as a second pair. If you want your family and friends to benefit as well, then gift it. It is a customizable gift box that lets them choose their own pair of sunglasses or eyeglasses, cleaner, cloth, case, or gift card that can be used towards their prescription while you get the credit for the gift of sight. Once your new eyewear is completed, we'll adjust and fit your finished product right here on location. We have planned times on your Cedarfield calendar where we will be in the clinic for our independent residents, and we will come room to room for our assisted living residents. Let Optiques know what works best for you. Optiques at Cedarfield, where vision meets style.
There we go. Thank you. I hope you guys enjoyed that. I'd like to thank Rafiq. He produced that for us, so thank you so much for taking the time to do that. It was pretty great. So hope you guys got some information from that as well. I also wanted to take a few minutes. A very common thing that I run into is people have coatings or things like that they have on their glasses, and they're not really sure what they have. They're not sure what they need. They're not sure what is out there. So I just wanted to go over a couple things that I thought would be useful for you guys to know. Let's see here. Anti-reflective coatings are one of the most common coatings that you'll hear about or see on your glasses. For those of you that are not sure whether you have that or not, a good way to tell is if you're wearing them, you can take them off. If you kind of tilt them in the light, you'll see a clear or white kind of reflection. If you see a rainbow, greens, blues, any of those types of colors, then 9 times out of 10 you have an anti-reflective coating on there. And just like the dermatologist representative was saying, it also has UV protection, which is great for the growth of cataracts, things like that. So make sure, no matter what, that you do include UV protection in your eyeglasses. Now, UV does come standard with an anti-reflective coating. So if you have it, you do have UV protection as well. I wanted to talk about transitions. And before I talk about transitions, I'm going to have actually a sample of the AR, which is short for the anti-reflective, being passed around so you guys can see the difference between a non-anti-reflective and an anti-reflective. I'm going to have Ruwari pass that around to you guys, also known as Ru. He is very, very helpful to me during our day-to-day. You'll see him here at Cedarfield as well as Optiques. If you see him here and you have a question, please feel free to grab him and ask him whatever question you have, and we'll be glad to get you helped out, okay? And this is the sample. You guys can pass it around. And while you guys are taking a look at that, I'll go over the transitions. Now, people get confused with transitions and progressives. Transitions are ones that change to sunglass when you walk outside and become clear when you come back. Progressives are actually the no-line bifocal. Transitions are good if you're going in and out frequently and you don't want to have to switch between 2 pairs. Otherwise, I would get a good pair of polarized sunglasses because it offers better protection for your eyes, usually has better coverage, and like transitions, they work better in cold weather. Now, most people are out in the sun during the summer, so you'll find that, again, the polarized sunglass will offer you better protection, even though I have plenty of patients that just adore their transition lenses. So it's completely up to you on that. Another great coating to consider if you're really rough on your glasses or accident prone like I am, something called TD2. It's an extra layer of scratch resistance, so it's a better protection for your lenses. And when you put your money into your glasses, you want to make sure that you are making sure that you have all the necessary coatings that are going to be protecting this new eyewear. Let's see here. A lot of you have probably had or considering at this time cataract surgery. Now, with cataract surgery, you'll notice more glare, light sensitivity, starburst, and that's a lot to consider when getting your next pair of eyeglasses. You want to consider anti-reflective to help with that glare. You want to think of polarized sunglass to help with the starburst or the light sensitivity. Excuse me. And so that's just a couple of different lens options that are out there for everyone. And if you have any questions about it, we'll be available afterwards to answer any as well. Another common question that I get is, how do I properly clean my glasses? Again, you've put your hard-earned money into a pair of glasses, you want to protect it. So an easy way to remember what not to use is anything with the word paper in it. We're talking paper towels, toilet paper. Those have small wood chips in them that over time will eventually scratch your lenses. So let's stick with 100% cotton. You can cut up a t-shirt that you've had that's nice and clean, or you can use a microfiber cloth. Do not let glass cleaner fool you. It is not for your eyeglasses. It is for glass. Glass cleaner like Windex has ammonia in it, which will eventually deteriorate your lenses and your coatings. So please do not use any glass cleaners. You can get eyeglass cleaner from us here at Optiques or anywhere else. It has a little bit of alcohol in it, which will help with oils that you get on your lenses. You'll see those smudges that are kind of, the more you wipe them, the more they just kind of smear. That little bit of alcohol will help take that off from your hands and your face that's transferred there. If you don't have access to lens cleaner, Dawn dishwashing liquid is another easy thing to grab. Most of you probably have it now. You just run it under your glasses under the water, put a little bit of Dawn, it's very sensitive, and then again just dry it off with 100% cotton or a microfiber cloth. Let's see here. So I wanted to thank you all for you taking the time to be here and listening. I hope I was able to provide you some useful information in the purchase of your next glasses. I'm going to turn it over to Dr. King now, but before I go, I'd like to explain how you could schedule with us. We will be bringing a selection of eyeglass and sunglass frames over here. Again, you'll see it on your monthly calendar. If you don't already have the phone number, it is 804-562-3333. Nice and easy to remember. You'll be able to reach me, and you'll also be able to schedule with Dr. King as well. Independent living residents, they can schedule here at the clinic. We're also talking about scheduling for transportation for you guys to come over to our local office, again on Parham Road, right across the street from J.R. Tucker. The assisted living residents, you can schedule, and I will come room to room, and I will also bring a selection of frames. You can also look online and choose from there as well, but we're trying to make it as convenient as possible. Dr. King will be transitioning over to Cedarfield for vision-only exams, but for now you can call to schedule for a full exam at our office, at our local office. I accept some vision plans. Dr. King accepts medical insurance, so your Medicare Advantage plans, and some commercial as well. Thank you again for your time, and I look forward to working with you in all your eyewear needs. Here's Dr. King. He's going to talk about dry eyes, eye vitamins, macular degeneration detection, and some home remedies that you might find helpful. We brought some samples and some coupons that we have on the back table. So when we're done here, feel free to stop by, talk to us. We'd love to meet you and pick up whatever samples you'd like. So thank you again, and here's Dr. King.
You go keep the microphone so you can talk.
Yeah, I'll make sure.
We just spend a few minutes here to go over some things that you can do just to keep your eyes healthy. And you don't have to see the doctor to do it or anything like that. And we have some samples that we'll go give you. And Melissa's going to have the microphone there, so if you have questions about what we are doing as far as the samples, she can give you the microphone there. Or if you have questions on other eye problems and stuff, I can answer them as best I can with the information that we have. So what we want to do is to start off with just some general principles. The one thing that most people probably don't realize, but the eye itself is really closely associated with the sinuses, with the ears, and with the throat. So if you have anything going on in any of those places there, then all of these different conditions can get involved there. If you have a sore throat, you can get a conjunctivitis from it and inflammation on the eye. So you have to realize that you just don't have one little problem there and all the other things around your head is doing fine. So that's the main concept there. And if you start noticing your ears get a little clogged or something like that when you have a sore throat or something, then not only has your throat become inflamed, but your ears are inflamed too. So all of those have to be treated and everything. The first thing I want to talk about here is dry eyes. Of course, as we age, everybody's eyes get dry, and particularly if you have arthritic problems and things like that, then you can have more problems with that. And there are all kind of different treatments for this, but the simplest thing to do is to use artificial tears. And what we got, you can take the retinane samples and give each one of them this sample here, and I'll explain how to use it and what it's all about. If you go to the grocery store or drugstore or stuff and look at the shelf, you're going to find a whole row of artificial tears. And there are basically two types of artificial tears. One is an unpreserved artificial tear, and you use that if you think the preservatives in the tear will irritate your eyes, or the other, which you're most familiar with, is a bottle of tears. Now the bottle lasts months and months when you use it, but it also has preservatives in it to keep it from getting infected. So there's nothing, and it's cheaper. So you can try the bottle tears first, but what you're going to get a sample here of a unpreserved artificial tear. And what this does, this comes in a little plastic vial, and it's only got 4 or 5 drops in it. And the reason for that is, once you open it up, it will become infected, within a few days and things. So you need to use those tears as soon as you can, within a day or two. And the usual, a lot of people say, well, I use tears just at bedtime. There's nothing wrong with that, but most people will use artificial tears twice a day. After you wash your face in the morning, you use them, and then when you get ready to go to bed at night, you put some in too. Some of them are thicker, some of them are thinner, and so you have all kind of variations. But start off with the bottle tears, but if you put those in and it kind of irritates your eyes, then you can go to the unpreserved tears here. And these all come in little plastic vials. Any questions on that? And they tend to be, the little vials tend to be more expensive than the bottle of tears there. But that's the basic thing, and usually the more moist you can keep the cornea in the front of the eye, the healthier your eyes will be and the better your vision will be. Now, so that's the main thing you need to comprehend there. Now, if you find your eyes really get real dry at night, you can actually go to a thicker tear or even to a tube of tears. They call them lubricants. And that's more almost like a Vaseline that you have. But the problem with that is if you put it in at night, it keeps your eyes good and moist and everything, but the next morning you're fuzzy. So you have to wash your face off to get rid of the oil that's there. So, but the more you can keep the front of the eye lubricated and hydrated, then the healthier your vision's going to be and the better you'll see there. So does everybody have an artificial tear there? Any questions on that? She'll give you the phone. Microphone.
Refresh gel.
That's a brand. Is that right? Yeah.
Mm-hmm.
Yeah. Now the Refresh gel, that is a thicker tear. Now does that come in a little tube or a bottle?
A little bottle.
Yeah. And as long as you get it in a bottle, you know it's not going to be real thick. But if it comes in a tube, it's going to be almost like Vaseline. Okay. But Refresh is a brand, and the retinane is a brand. Another common brand is Cystane.
Yeah,
Cystane. And there are 2 or 3 others that you can do too. But what you have to do with the tears is you just have to experiment with them. And you'll find that one will sort of soothe your eye a lot better than the others. But that's the one thing that you can do to keep your eyes good and moist and healthy, and particularly if you find that you have arthritic problems and stuff, that tends to go along with your eyes getting dry. So
how often should you use them?
You can use them up to 4 times. The tears, you can use them up to 4 times a day. Now, the ointments and things, you just put that in at bedtime because it blurs your vision. But anywhere from, the average person will do it twice a day, morning and night. But you can use it 4 times a day without any problem. Any other questions? Okay. The next thing we want to talk about is quite often, from time to time, particularly if you have a cold or you have sinus trouble or stuff, you wake up in the morning and your lids are sticky or kind of crusted. And have any of y'all noticed that in the past? Okay. What you do is you can use a lid scrub. Now, let me explain to you. Can you give them the different samples there, and we'll explain it. A lot of people say, well, it's sticky or gummy. So what I do is I just wash my face with a washcloth, and that takes care of it. And that's fine. That's fine. But if you want to do something a little bit more specific, you can actually use what we call a lid scrub. Now, you can make your own lid scrubs up, and you don't have to pay as much for them. And what you do is you use some of these makeup remover rounds there that are cotton, little cotton swabs, You take this, put a drop of baby shampoo on it when it's moist and suds it up, and you just close your lid and rub it right across your lashes about 10 times. And that scrubs off all that debris that's on your lashes and makes it so that your eye feels better right away. Now that's the thing that you can do. It won't cost you much. You can also get what you call lid scrubs from the pharmacy. And lid scrubs come, they are little soapy pads. And when you pass them around, maybe open up one if somebody wants to touch it and see, and it's soapy. And most of them are mainly, they will suds up for you. So you open them up. Some of them will tell you to put a drop of water on it. Some of them will say you don't need to, but you kind of rub them between your fingers to get them sort of soapy. And then you close your lid and just rub it across your lashes, and you do it about 10 times. And that will scrub off all that infected debris that gets into your lashes and everything in the morning. And particularly if it gets real crusty and everything, sometimes just regular washcloth won't clear it up, and see, but the lid scrub will. Now, the thing about the lid scrub is there are different types of concentrations of the soap. And so this one brand is called OcuSoft. That's the ones that are very common in the pharmacy sections there. This one not only has soap in it, but it's got it's got a green tea extract, and it also has tea tree oil. Have you ever heard of tea tree oil? Tea tree oil is sort of an antiseptic. And the nice thing about it, well, people say, well, I can't put tea tree oil on my eye because it'll irritate it. Well, this has the right concentration in it, so it won't do that. But you can get some of them, and what you do is if you're going to get the pre-made ones from the drugstore, then look on the back of them and see what it has in it, and it'll tell you whether it's got the tea tree oil. This has actually green tea extract too, but some of them are just plain soap and things. Believe it or not, ever heard of blepharitis? Blepharitis is a chronic irritation of the lid. It gets kind of red and crusty and can itch and burn, and it's very similar to dandruff, so you really can't get rid of it completely. But you wouldn't believe it or not, but these lid scrub things will really control it. And so if you use lid scrubs off and on, you'll find that your blepharitis will not bother you as much. And of course, if it gets severe, we have to use antibiotic steroid medication and stuff. And that's fine, but that has other side effects from it and stuff like that, where the soapy pad doesn't have that either. So any questions about the lid scrub? Now we're going to talk about the vitamin or eye care for the nutrition care for the eyes. And a lot of people say, well, says I don't have that problem because I get good balanced food diet and everything like that. But the problem with the nutrition is a lot of times First of all, you can't eat the quality of food that you used to eat because you get too obese. So you usually cut back on your food, and then a lot of times you find there are certain foods that you don't tolerate anymore. So you really have to I think you need to use supplementation of different types of vitamins and things to, now he's passing around this vitamin supplement here called AREDS 2. Have any of y'all ever heard of AREDS 2? It's you get on TV. It's advertised as Preservision, and but that's the treatment for dry macular degeneration. Have you heard of that? Okay. There are two types of macular degeneration. One is wet, and one is dry. The wet type is due to leakage of vessels, and if that's the case, you need shots in your eyes for that. It's an anti-inflammatory type of shot. But very few people have the wet. Most people have the dry macular degeneration. And that is a nutritional thing. And the AREDS 2 formula there, which has 6 different things in it, it's got vitamin C, vitamin E, it's got zinc and copper, lutein and zeaxanthin. Lutein and zeaxanthin is a pigment there that is in blueberries and different types of vegetables and things. And that's the treatment for dry macular degeneration. And you say, well, I don't have that, so why should I take that? And some people say, well, I take a multivitamin, and that's fine. But you can take your multivitamin and check it with the AREDS formula there and see if you're getting the equivalent amount of copper and zinc and things like that in it, see? So, but I think it's a good idea to use some supplementation to get your proper nutrition as far as the vitamins and minerals. And since that has been proven to be the treatment of choice for dry macular degeneration, then I think that's the thing that you want to really use as your baseline type of vitamin and things like that. And I can't tell you that it's been proven if you take that you won't get dry macular degeneration. But a lot of people feel if you take it, you have less trouble with dry macular degeneration. Dry macular degeneration is a scarring of the retina in the back of the eye. So it's sort of a degeneration like you get on the skin of your hands and things like that. And so think about the AREDS. I'm not telling you have to do it, but it's one thing that you can do, and you can do it yourself. You don't have to get a physician involved with it. And of course, the other thing, it's good for your eyes. And your eyes the retina is nervous tissue which connects to your brain. And if it's good for the retina nervous tissue, it very well may be good for the brain nervous tissue. And since we all tend to think that we have cognitive problems there and things like that, you ought to get as much nutrition as far as you can for the nerves and things. Now, there's one way you can check. Do we have the AMSLA grid we can show them? You can actually check this yourself, and once she passes that out, I'll explain it to you. And if any of you want to try it, and we can see if it's all normal for you. What it is, it's a little piece of graph paper, and it's got a dot in the middle. Do any of y'all know about that? Okay. Now, the problem you have with this is a lot of people say, well, that's a piece of graph paper, and I look at it and say, that can't be accurate. It doesn't mean much. That is more accurate than almost any test that I can do to look in the back of the eye, because it will show up distortion. And what you do is you check one eye at a time. And a lot of people will take it and put it on their refrigerator or someplace where they walk by regularly. And once a week or something, you just stop for a moment and you cover one eye and then the other eye, look at the piece of graph paper and look at the dot. And when you do that, you see the lines in your side vision. And if the retina has normal anatomy, the lines are straight. If the lines bow or bend at least a little bit, it means your retina is swollen. And even if you feel like you're seeing well, that's something you should have it checked, because that can be an early sign of dry macular degeneration. Well, an early sign of both dry and wet. But it's a simple test that you can do. Now, it is subjective, and so that's a problem. You know, if you don't pay much attention to it, you're probably not going to get a good result. But if you really get lined up right there and look at it and do one eye at a time, and if those lines are not straight, then you need to see your ophthalmologist right away. Any questions on that? So those are things that you can do, and you don't need a medical doctor to do any of those. You can use the lid scrubs to keep minor irritation down on the front of the eye. You can use artificial tears to keep your eye lubricated. You can figure out what type of nutrition you need to, and you can look at the AREDS formula there to give you an idea of what you really should supplement with. And if you do that, though, then that gives you the best chance of keeping your eyes good and healthy. And now the AREDS 2 is a formula that the National Institutes of Health, they have studies every now and then, and they make up these vitamin formulas. And so it won't be long before they'll have another study going, and they might call it AREDS 3. So at some point, you might actually go and see that something says AREDS 3 on it, which means it's a more recent study and everything. But it's all nutrition, and they pick out the minerals and the vitamins and stuff that they think is important for your eyes, your nerves. And of course, remember, it's not only the retina, but it can be your brain too. Any other questions? Melissa's got the microphone in case you want to ask it. She has the optical shop right across from Tucker High School, where my office is, right next to my office. But she comes out here and actually will take care of your optical needs and stuff like that. So they will set up an arrangement for all of that. And if you want to, if you have something going on that needs our equipment, like a slit lamp and stuff like that, then within a day or two, we can always see you over at the office there. So they can set that up. Okay?
All right, does anyone have any other questions for either myself or Dr. King? All right, well, thank you again for coming. We really appreciate it.
Okay.
Enjoy the rest of your day.
Let's use the eye scrub.